Okay, this is part 2 of mental disorders. We're going to start off with anxiety disorders. This class was previously known as neuroses. This is when the anxiety moves from the realm of normal to abnormal, when it persists and prevents the person from leading a normal life. There are 4 classifications: generalized anxiety disorder, panic disorder, phobic disorder, and obsessive-compulsive disorder. A person's behavior is dominated by anxiety. Okay. So, talk about the first one, generalized anxiety disorder. This is a constant state of anxiety about most things. It's not situation specific. It's also known as free-floating anxiety. They constantly worry about previous mistakes and future problems. Panic disorder. Anxiety is also unfocused here. Anxiety begins suddenly and unexpectedly, reaching a peak within 10 minutes. The attack is often accompanied by a sense of impending doom, going crazy, losing control, or dying. Now, this is differentiated from generalized anxiety disorder by its sudden, intermittent nature of greater severity. Now, when I first moved here, I actually had panic attacks. It scared the living daylights out of me because it came out of nowhere. I was prepping for a new class. I wasn't getting any sleep. I had just moved here to Texas. Just everything was going on at once, and I was driving home one day and everything seemed to be fine. It was the end of the week, and all of a sudden I thought I was having a heart attack. And the problem with these panic attacks, or this panic disorder, is once they start, the severity starts increasing because now you're scared of them. So I have gotten that under control, thank God, because that was not fun. Okay, the next one, number 3, is a phobic disorder. This is marked by excessive, persistent, and irrational fear and the avoidance of phobic stimulus. The source of anxiety can be an object or situation, but it poses no actual danger. So you put a lizard in front of me, you're going to see this old girl just bounce around it to get away from the lizard. Number 4 is the obsessive-compulsive disorder. This is marked by obsessions, which are persistent intrusions of unwanted thoughts, and compulsions, uncontrollable urges to carry out certain actions. Germs says they're constantly washing their hands. Both features usually occur together, but not always. The patient exhibits anxiety if he or she is prevented from performing special rituals which are used to shield against overwhelming anxiety and fear. So if anybody watches The Big Bang Theory, when Sheldon knocks on Penny's door and he goes, knock, 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 Penny, knock, 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 Penny, knock, 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 Penny, and he always has to do it in increments of 3. Okay, so that's an obsessive compulsive. And then we have post-traumatic stress disorder, and this is a delayed response to an external traumatic event that produces symptoms of extreme stress. PTSD differs from other anxiety disorders because the cause of the stress is an external event of an overwhelmingly painful nature. War, Hurricane Katrina, the tsunami that hit, and rape. These are some examples of post-traumatic stress disorder. Now, we're going to talk about a group known as the Somatoform Disorders. This is a group of mental disorders in which the person experiences physical symptoms without the underlying organic cause. The symptoms are real to the affected person and not feigned. No confirmed diagnosable medical condition accounts for the symptoms of somatoform disorders. They may have physical symptoms such as pain, nausea, depression, or dizziness, also called pain disorder or body dysmorphic disorder. First one is a somatization disorder. It's also known as Burkitt syndrome. It consists of a number of recurring somatic symptoms that have no underlying clinical basis. The symptoms appear before the age of 30 and continue for several years. The next somatoform disorder is conversion disorder. When the anxiety is changed or converted to a physical or somatic symptoms. When anxiety is too difficult to face, it may be unconsciously converted to a physical or somatic symptom to allow the person to escape or avoid the situation. It's usually precipitated by a highly stressful situation, and it's formally termed hysteria. So let's say you find out that your wife, let's say, I'll give the guys a break on this one. The wife has been having an affair for 5 years, and this is very stressful to a man, and so he develops breathing problems. But he really isn't. It's the stress causing this somatic disorder. The next, somatoform disorder is a pain disorder, and this is manifested by pain that causes significant distress and physical and social impairment to such a degree that it takes control of the person's life. Hypochondriasis is another somatoform disorder. It's the fear of having a serious disease, even though medical causes cannot be found to substantiate the fear. The fifth somatoform disorder is Munchausen syndrome. This is considered a factitious disorder. It occurs when people simulate symptoms of illness, knowing that they are not ill, and they seek medical attention as a way to draw attention to themselves. Now, factitious disorders are different from malingering or the feigning of symptoms for financial or personal gain. Okay? And just in general, factitious disorders is a group of mental disturbances in which patients act physically or mentally ill without obvious benefits. Okay? Now, in Munchausen, so they'll do the research on some, like, I don't know, pick a cancer or something like that. So they know exactly what to tell the doctor when they talk to him about their symptoms, and it's basically a cry for attention. Now, the next one is Munchausen's by proxy, and this is when a parent projects symptoms to the child, which stimulates the illness in the child and causes the child to present for treatment. The parent denies any knowledge of the actual cause and relates the symptoms to be GI, genitourinary, or something else. Now, gender identity disorders. These are conditions in which individuals feel a powerful connection with the opposite sex and want to be the opposite sex. Individuals believe their current gender roles are inappropriate. He or she should really be the opposite sex. Now, this is not the same as homosexuality. Homosexuality is you don't want to be the other sex. You want to be with your sex. Okay, so there is a difference. Now, some sleep disorders. First one is insomnia. This is a disorder associated with having difficulty falling or staying asleep. As a result of poor or interrupted sleep, the individual wakes feeling physically tired, groggy, tense, irritable, and anxious. To be diagnosed with insomnia, the sleeplessness must be longer than 1 month and must interfere with the normal functioning in a social, occupational, or other areas. Okay. Another sleep disorder is a parasomnia. This is a group of sleep disorders that include sleepwalking, night terrors, nightmares, and bedwetting. It's characterized by partial arousal before, during, or after the event. Parasomnias usually occur in children early in the night. This is a group of acute, undesirable, episodic physical phenomena that usually occur during sleep or are exaggerated by sleep. Most are precipitated or perpetuated by stress. Or perpetuated by stress. We have narcolepsy. A chronic neurological condition in which a person has an irresistible tendency to sleep during the daytime for a few seconds to half an hour. This is usually precipitated by sedentary, monotonous activity. This is also a sleep disorder. And the last sleep disorder is sleep apnea. This is intermittent short periods when breathing ceases during sleep and can be potentially, sorry guys, life-threatening. It's categorized as either obstructive, when air is unable to flow in and out of the upper airway, or central when the brain does not send appropriate messages to initiate the breathing process. And the last thing we're going to talk about are personality disorders. This is a pattern of behavior that deviates from society's norms and is typically rooted in a person's thoughts about him or herself. It often produces chronic, ingrained, and maladaptive behavior. There are 10 personality disorders characterized into 3 clusters. Okay, so cluster A is odd, eccentric behavior. Cluster B is a dramatic, emotional, or erratic behavior, and cluster C, they're anxious or have anxious or fearful behavior. And that's it.